Well, good morning to everyone. And I know some people are getting on and we're expecting more to be joining soon. It is my pleasure to welcome all of you to the first of our fall symposia. Some of you may have participated in May, and we're excited to be back sharing more awareness and education. I'm going to spend just a few minutes going over some logistics and helping you get acquainted with our day. So also just a quick shout out. I know all of us are doing the best we can right now. I've got kids learning remotely here. We have a brand new puppy that you'll probably hear soon, and we're just doing the best we can. So just looking forward to us being gracious with one another and having a great day. I'd like to begin by acknowledging our partner for this program, the U.S. Pain Foundation, and you'll be hearing more about them from presenters here in just a few minutes. Want to also add, we work with many different patient organizations as one of the key stakeholders, and we make a very important concerted effort to ensure the voice of people with pain are in all of the work that we do and the work groups that we facilitate. So again, a thanks to US Pain and all the other patient groups that are part of their commitment to this topic. A huge thank you to the primary funder for our initiative, the David and Laura Lovell Foundation. This initiative is called A Paradigm Shift to Advance Comprehensive Integrative Pain Management. And we intentionally are not our own organization, but instead connect the dots with many other organizations. And we could not do that without the work and passion of our fiscal sponsor, the pain community, who are working behind the scenes to help make this happen. Continued thanks to other AACIPM sponsors for this year. We really want to emphasize the importance of leveraging our resources together and collaborating towards our shared interests in advancing this approach to care. So thank you to these organizations. And as a reminder for those of you who know about AACIPM, and also for those who this may be the first you've seen of this alliance, the Alliance to Advance Comprehensive Integrative Pain Management is a multi-stakeholder collaborative. So we bring together and activate key stakeholders in this shared interest to advance access to comprehensive integrative pain management. You can see on this list some of the different stakeholder groups that are involved. And at the link on our website, you can see specific organizations that have been involved in the past, present, and our future work. With our core work being to increase access to CIPM, we do this in a variety of ways. And just like in this symposium today, we bring together important stakeholder voices to be in the same room. And we believe that is very helpful in helping to look at what are the practical needs for advancing policy and practice change towards this effort. So we share and develop resources related to that, and we work in partnerships, and that's extremely important. An example of partnership we're working with as well is with purchaser coalition. So employers that are trying to understand how to change benefit design to increase access to comprehensive integrative pain management. And we have a work group addressing that now too. So just a quick word about what we know about pain. Understanding what is behind pain, I think we all agree, begins with the biopsychosocial model. And I want to thank the HHS Pain Management Best Practices Interagency Task Force for this beautiful visual that really highlights this so well. And that task force led by Dr. Vanilla Singh, she is one of our advisory committee members. And in a minute, I'll be introducing Cindy Steinberg, who was another member of that task force. We'll be diving deeper today into these factors and how they really impact and play a significant role in the access and utilization of integrative therapies for pain. So what is comprehensive integrative pain management? This is focused on the whole person. This is interdisciplinary, evidence-based, patient-centered, multimodal care. And I think it can be suffice to say it's really moving from what's the matter with you to what matters to you. And we see this exemplified in different arenas such as the VA's Whole Health Initiative, and really excited to continue to share this with all of you today. Our objectives for today are to connect the dots among these important national efforts to advance this care for people who are underserved, to discuss the practical realities that exist for people with pain, providers, and payers when it comes to addressing access. And we hope sincerely to provoke thought and action among stakeholders like you and others to advance this paradigm shift that aligns payment design and delivery of patient-centered care. I think all of us are quite familiar with Zoom by now, but just a quick note for those who may not be, you have a Q&A and chat feature on your screen. Please use the Q&A feature to submit questions to the speakers. Our presenters will be answering verbally when they can, and they're also able to answer through the Q&A feature as well. So we look forward to all the questions you may have, and we'll do our best to get to them throughout the day. The chat feature is for the hosts to help with any troubleshooting that you may have. So anything that you need to share with us that is not a question to the presenter, use the chat feature, and we'll also use that for sharing information with you throughout the day that may be relevant to what the presenter is saying. Another reminder, all of the symposium materials are available and ready. So I know this can be frustrating, and hopefully this makes your life easier today. The agenda, the presenter bios, all the slides, the survey will be coming, recordings will be uploaded soon. Everything is there at /equity on our website. So you can find it there. Next slide, please. Just a shout out for social media. We have an amazing group of more than 75 organizations that have been involved in our efforts. So we want to keep this momentum going. If you want to post or share about today, please use the hashtag AACIPM. You see the Twitter hashtags here for us in US Pain, and we just look forward to seeing you out there. To help you plan for your breaks today, we have a full agenda, and our first session will begin in just a moment and go until 1 o'clock. Then we'll have a short break, and we'll have a great breathing exercise thanks to Matt Taylor right before we resume. So be sure to check back in around 1:12 or so to get that experience. Then we'll begin session 2 at 1:15, and we'll have another breathing exercise during that time thanks to Gwen Herman. So please get comfortable, move around as you need to, grab what you have. We know this is a long day. We know it's a lot of information to ingest. We don't do that to make this harder for you, but we do it because it's really important information to share from different stakeholder views. We believe that adds to the richness. So we are recording all the sessions, and they'll be available as a resource as long as you need them and uploaded soon.